momentous occasion, the Commonwealth Nurses and Midwives Conference. The convergence of brilliant minds, skills hand, and compassionate hearts from across Commonwealth family is not just a meeting. It is a powerful testament of our shared commitment, our universal challenges, and our collective aspiration for excellence healthcare. To see our nation, Nigeria, playing a host to this prestigious assembly is a dream-filled and milestone we deeply cherish. On this significant platform, I must begin by expressing our profound gratitude. First and foremost, our sincere appreciation goes to the government of the Federal Republic of Nigeria under the visionary and dynamic leadership of His Excellency, President Bola Ahmed Tinubu, GCFR. Your administration's unwavering support and endorsement have been a cornerstone that make hosting of this global event a reality. Your relief in power of healthcare diplomacy and professional collaboration is a commendable and has provided us with a platform to showcase Nigerians' hospitality and potential to the world. Thank you, Mr. President. And I want to assure you at this point that nurses and midwives of this country are solemnly behind you. And we will never disappoint you. In the same vein, we must applaud and celebrate the exceptional leadership of the leadership at the Federal Ministry of Health. Our heartfelt commendation goes to the Honorable Coordinating Minister, Professor Muhammad Ali Fati, and his team, whose relentless drive, innovative policies, and transformative agenda have recorded numerous tangible achievements in our healthcare sector within the remarkable shortest period. From strengthening primary healthcare infrastructure to advancing health insurance coverage and prioritizing the welfare of health workers. Your tenure is already leaving an indelible mark. Your presence and support for this conference underscores your commitment not just to Nigerian healthcare, but to global health solidarity. We say a resounding thank you. To our distinguished guests and delegates from across Commonwealth nations, we say welcome. You have traveled far to be here, bringing with you a wealth of experience, diverse perspective, and the rich tapestry of our culture. Over the next few days, this conference will transform into global hub for learning, sharing, and networking. We have a robust agenda designed to tackle pressing issues from strengthening health system and achieving universal health coverage. To address working force challenges, embracing digital innovation in nursing and midwifery, and sharing best practice in maternal and child health. To my fellow nurses and midwives, you are the very reason we're here. You are the backbone of every health system and the best and often last point of care for millions. The compassion caregivers in time of vulnerability and the unsung heroes in times of crisis. This conference is for you. It is an opportunity to recharge, to learn, to advocate, and to reaffirm our vital role in shaping healthier society. Let us engage fully, challenge constructively, and build resilience that will ensure beyond this world. As a host, we, the Nigerian nurses and midwives, pledge to ensure your stay is not only productive, but also comfortable and memorable. We hope you will find time to experience a world of Nigerian people, the reach of our culture, and the beauty of our land. Let us therefore, in the spirit of Commonwealth of shared value, mutual respect, and common goal, proceed with our deliberations. Let this conference be a catalyst for change, a beacon for hope, and a powerful voice for the nursing and midwifery profession worldwide. Once again, you are all welcome to Nigeria. Thank you, and may our deliberation be fruitful and impactful. Thank you, and God bless you.
Your Excellencies, very distinguished ladies and gentlemen, thank you very much, Mr. President, the National Association of Nurses and Midwives, Nigeria. You've given us an insight, and we believe in your strength, and we believe in your solidarity, and we believe in your spirit of comradeship. So therefore, please, let's put our hands together for him, ladies and gentlemen. And quickly, may I have the privilege and honor, Your Excellencies, to invite Professor Kathleen McCord, the President, Commonwealth Nurses and Midwives Federation, for her very, very brief remarks. She had been very, very resourceful, and I think I will plead with the Nigerian government that please, approval should be given. I will give her a plot of land in Kafanchan.
Your Excellency, thank you very much indeed for finding time in your very, very busy diary to be with us all today. And you're bringing your wife. It's wonderful. Thank you very much indeed. Being a nurse, and I'm embarrassed to say I've been a nurse for 50 years. You can't believe it. You are with patients and families at the very best of times, but also at the very worst of times. So it is very, very important that nurses and midwives use their heart and their head. And I think what I have seen this morning in this vast, splendid hall is lots and lots of nurses with lots of caring, ensuring that they deliver good care, safe care, and look after their colleagues as well. So, Your Excellency, honoured and distinguished guests, thank you so much for making this journey. It is very, very much appreciated, and I bring you the very, very best wishes from the Commonwealth Nurses and Midwives Federation. Thank you.
Your Excellencies, very distinguished ladies and gentlemen, please, let's put our hands together for this very wonderful and brief remarks. Before the next item, as I've been waiting, let's do a bit faster because some of us will be going back to Abuja today. You might not know, some of us who had our first degree in National State University, and our postgraduates to PhD level, I think we know that, yes, nearness is never a closeness, but it is truly. It's either you are from FCT or you are from Nasarawa State. Like people in Mararaba, they claim they are in FCT, but truly, their tax goes to Nasarawa State. So stop sharing our territory. Some will imagine and said, why do you say we are not in Abuja? So we are going back to Abuja because some of us are going back to Abuja. Abuja, the main Abuja is Nyanya, Gwagwalada, Sileja, and Mararaba. So some of us are going back to Abuja in a short while. So we need to be fine. I have a flight to catch. Your Excellencies, very distinguished ladies and gentlemen, we have in our midst the Director of Hospital Services, Federal Minister of Health and Social Welfare. She's here with us, Dr. Mrs. Abishola Adegoke, MNI. Thank you very much. And for the next remarks, ladies and gentlemen, may I invite the representative of the Honorable Minister of Health, a Permanent Secretary Designate, Dr. Camille Sheritere, to please come forward for the ministerial remarks. Please do put your hands together for him, ladies and gentlemen. Please, let's clap for our designated Permanent Secretary.
Your Excellency, President Bola Ahmed Tinubu, DCFR, ably represented by our Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pati. Our Excellency, the Minister of State, or FCT, Dr. Miriam Mahmood, our host. Your Excellencies, the Executive Governor of Nasarawa State, and your beautiful wife, Excellency Deputy Governor of Nasarawa State, representatives of various excellencies from Katsina, Plateau, Adamawa, our Royal Highnesses, distinguished leaders of the Commonwealth Nurses and Midwives Association, Federation, President Executives and members of the National Association of Nigerian Nurses and Midwives, esteemed delegates from Commonwealth countries, representatives of our development partners, health professionals, distinguished guests, ladies and gentlemen, and of course, our beautiful nurses and midwives in the house. You are recognized. Our heads of various government agencies, directors of the federal ministries and agencies, distinguished Senator Wadada, you are welcome, sir. I'll read this speech on behalf of my Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pati. It is my honor to welcome you to Abuja for this regional conference of the Commonwealth Nurses and Midwives Association. This gathering comes at a time when health systems are increasingly judged by their ability to deliver consistent care at scale. Across countries, the same pattern holds, where the front line is present, prepared, and supported. Utilization rises, quality stabilizes, and outcomes improve. Where it is not, systems underperform, regardless of investment. The theme of this conference, Towards Excellence, nurses and midwives working together towards excellence in education, practice, and regulation, speaks directly to the foundation of a high-performing health workforce. Nigeria's current reform efforts are aligned with this imperative, recognizing that system performance depends on how well these three dimensions are strengthened and sustained. The workforce as the determinant of system performance. In Nigeria, nurses and midwives contribute the largest segment of the health workforce and are central to how care is delivered across the system. They sustain primary healthcare services across communities. They anchor maternal and newborn care. They maintain continuity between households and facilities. Their presence determines whether services are used, whether standards are upheld, and whether outcomes improve. This is why the current phase of reform treats the workforce not as a supporting element, but as the operating core of our system. Under the visionary leadership of His Excellency, President Bola Ahmed Tinubu, GCFR, Nigeria is implementing a bold intergenerational and structured reform of the health sector through the Health Sector Renewal Investment Initiative. The reform is anchored on 3 national priorities: to save lives, reduce physical and financial pain, and ensuring access to care. Its distinguishing feature is its operating discipline. Through the Health Sector Renewal Compact, bringing together a whole of government and a whole of society approach. The sector is being implemented using a sector-wide approach. The federal and state governments, the development partners, and non-state actors are aligned within a single framework defined by shared priorities, coordinated investments, and routine performance tracking. This approach is enabling more efficient use of resources by reducing duplication, aligning partner investments with national priorities, and ensuring that interventions reinforce one another. It is strengthening coherence and accountability across the system. This is shifting the sector from fragmented programs to coordinated delivery. The Health Sector Renewal Investment Initiative is organized around 4 interdependent priorities: governance and financing, service delivery and quality of care, access to medicine, vaccines, and essential commodities, and lastly, health security. These are not partial work streams. They function as a single system. Service delivery improves when the workforce is present and capable. Financing expands access only when services are available and trusted. Medicine and commodities produce outcomes only when correctly administered at the point of care. Health security is as effective as the human resources available to deliver it. Across all 4, execution depends on people. Evidence of system movement. Recent performance data indicates that the system is shifting positively. Primary healthcare utilization has increased from approximately 20 million to over 45 million visits within the current reform period. This reflects increased service availability, stronger frontline presence, and a gradual restoration of public confidence. This progress is supported by efforts to strengthen primary healthcare functionality, including movements towards round-the-clock service availability in selected centers, improved staffing, and enhanced service readiness. At this point, I must commend His Excellency Governor of Nasarawa State and his team for contributing largely to this increase in service uptake. Please let us appreciate him, sir. Corresponding movements have been recorded in skill bat attendance, antenatal care coverage, and adherence to clinical standards in maternal care, reflecting gains in practice. Across the system, performance is being tracked and with increasing discipline. Joint annual review processes indicate that 37 of 41 presidential performance indicators have been achieved within the current review period. At the subnational level, 35 of 37 states have conducted state joint annual reviews, while all states have aligned with the annual operational plans with national priorities. In addition, the deployment of young health fellows across all 774 local government areas in our country is strengthening coordination, data use, and implementation support at the front line, working alongside state teams and facility level providers. These mechanisms are reinforcing accountability and ensuring that reform translates into measurable outcomes. Health insurance coverage is expanding significantly, increasing from 95,000 649 enrollees to over 1,098,000 within the current reform period. This is improving financial access and reducing out-of-pocket burden for many households. These shifts reflect coordinated action across the system. Data from performance tracking and joint annual reviews is informing decision-making, enabling resource reallocation and refinement of interventions across states and facilities. This progress is further supported by strengthening health information systems and digital tools for data capture, reporting, and performance management. Workforce expansion is being pursued at scale. Training capacity for nurses and midwives has increased from approximately 28,000 to over 115,000 admissions, alongside a broader national effort to train up to 120,000 frontline health workers across the country. This expansion is not only about scale, it is about strengthening excellence in education through improved curriculum alignment, enhanced clinical training, and preparation for evolving system demands. The National Health Workforce Registry is being expanded across states, improving visibility on workforce numbers, distribution, and skills. Recruitment has been accelerated, including the approval of 20,000 additional health workers, with a significant proportion drawn from nursing and midwifery. Thank you. Capability is being strengthened through structured training and supervision, while distribution efforts are ensuring that workforce presence reflects population need. The cumulative effect is increased workforce density, improved service coverage, and greater consistency of care, reflecting progress in practice. Nigeria's reform direction has also received continental recognition. His Excellency, President Bola Ahmed Tinubu, GCFR, serves as the African Union champion for human resources for health and community health delivery partnership. I think we should appreciate the President. Thank you. This reflects a commitment to translating continental priorities into measurable national outcomes. Migration and workforce stability. Migration remains a structural feature of the workforce landscape. Nigeria is experiencing increased mobility of health professionals in response to global demand, widely referred to as the JAPA phenomenon. It reflects opportunity because Nigerian nurses and midwives are recognized globally for their training resilience and clinical adaptability. A round of applause for our nurses, please. They are among the most sought-after professionals internationally. It reflects pressure because workforce density remains below optimal levels, estimated at approximately 1.68 nurses and midwives per 1,000 population. The response is structured. The National Policy on Health Workforce Migration, which we launched last year, provides a framework for data-driven planning, ethical recruitment, and engagement with destination countries. Retention measures are being implemented, including improvements in working conditions, clearer career pathways, and expanded professional development. At the same time, regulatory oversight through the Nursing and Midwifery Council of Nigeria continues to uphold standards and professional integrity, reflecting the importance of regulation within the theme of this conference. Workforce stability will depend on building a system that remains attractive, responsive, and capable of sustaining skilled professionals over time. Maternal and newborn survival remains a priority of this government. The maternal mortality reduction innovation and initiatives program, popularly called MAMI, strengthens demand, facility readiness, and referral systems across the continuum of care. This is complemented by the National Health Insurance Authority, which is expanding financial protection through empaneled facilities delivering comprehensive emergency obstetrics and newborn care, CMONC. More than 4,000 free cesarean sections have been delivered, reducing financial barriers to life-saving interventions. Thank you, Honorable Coordinating Minister. Improvements in maternal and child health indicators, including skilled birth attendance and antenatal care, reflects strengthened frontline practices. Nurses and midwives remain central to this continuum from antenatal care to delivery and postnatal period. Community engagement is strengthening awareness, trust, and timely utilization of services. Medicine supply chains and local capacity. Access to medicine and essential commodities is improving through strengthening supply chains and local production. Recent efforts, including over 1,200 regulatory inspections, more than 1,100 product registrations, and expansion of pharmaceutical manufacturing capacity. These measures are improving availability, strengthening quality assurance, and reducing dependence on imported products. Regulatory systems are being reinforced to ensure quality and safety, again reflecting the centrality of regulation. At the point of care, outcomes depend on trained professionals who ensure appropriate use of medicine. These efforts are being advanced in collaboration with the private sector to strengthen healthcare value chain. Under education, regulation, and professional standards, the Nigerian strategic directions for nursing and midwifery provides a framework for aligning education, workforce planning, leadership development, and regulation. Training expansion is being matched with improvements in curriculum, clinical exposure, and continuous professional development. Regulatory institutions maintain standards through licensing, accreditation, and disciplinary processes. Strong regulatory systems are essential to advancing excellence in practice, safeguarding quality of care, and sustaining public confidence. Nurses and midwives contribute across multiple levels of the system, extending beyond clinical care into supervision, service coordination, and performance management. Their role is increasingly connected to system delivery. At facility level, they support adherence to standards and continuity of care. At the subnational level, they contribute to implementation and operationalization of national priorities. Through performance reviews and joint annual reviews, frontline experience informs planning and corrective action. Strengthening leadership pathways ensures that those closest to service delivery contribute directly to system improvement. Our regional collaboration. The Commonwealth Nurses and Midwives Federation provides a platform for structured collaboration across countries facing similar challenges. It enables exchange of experience on workforce planning, education, practice, and regulation, and supports alignment with international standards. For Nigeria, this engagement informs ongoing reforms, particularly in workforce distribution, quality improvement, and retention. At the same time, Nigeria contributes its experience in implementing a sector-wide approach and strengthening system-wide performance. Regional collaboration supports convergence around standards and strengthens collective capacity across health systems. The focus on education, practice, and regulation provides a practical framework for collaboration and shared progress. Nigeria's hosting of this conference reflects a commitment to sustained engagement and cooperation. Distinguished colleagues, excellencies, the priorities reflected in this conference theme are aligned with Nigeria's reforms direction. Health systems function through people. Our efforts are focused on ensuring that those who deliver care are available, well-trained, properly regulated, and supported to perform consistently. Nurses and midwives remain central to this effort. Sustaining progress will depend on continued investment in the workforce, alignment across the system, and disciplined execution. Once again, I welcome you to Abuja and wish you fruitful deliberation. Thank you. God bless the Federal Republic of Nigeria and the Commonwealth. This speech on behalf of Professor Mohammed Ali Pati, Coordinating Minister of Health and Social Welfare for the Federation. Thank you.
Your Excellencies, our dear members of the diplomatic community here present, His Excellency, the Executive Governor, Nasarawa State, who happen to be, I think, among the best governors within the West African sub-region. And I think I have to pray to God fervently that when he's through with the services of Nasarawa State, we'll ask God give him a very special propelling political appointment or elective position that will make him more greater than this. As I will be his special advisor. Your Excellencies, very distinguished ladies and gentlemen, quickly may we take our remarks. It's going to be an online remarks from the Secretary General of the Commonwealth, Honorable Shirley Botway. Indeed, that's the first female. Before, we thought of responsibilities are only for males alone, but she developed a strength and propelled her very strengths that led her to be the first female Secretary General of the Commonwealth. Please, let's celebrate her, ladies and gentlemen, and let's sit back while we listen to this very amiable African.
My dear friends, it is with great pleasure that I join you for the inaugural Commonwealth Nurses and Midwives Federation West Africa Region Conference. I warmly greet all participants present in Abuja and across the region. And I extend my sincere appreciation to the National Association of Nigerian Nurses and Midwives for their generous support in hosting you all. This conference comes at a big moment, not only for the profession, but for our Commonwealth. Your theme speaks to something fundamental, because excellence does not happen automatically. It is built through learning, through dedication and service, and through strong systems that support you to do your work. And above all, it is built together. Across West Africa and across our 56 Commonwealth countries, nurses and midwives are the backbone of our health systems. You are there at the beginning of life. You are there in moments of crisis. And you are there every day, quietly sustaining the health and dignity of our communities. Your contribution is not only critical, it is human, social, and economic. And yet too often, your voices are not heard as strongly as they should be. Too often, opportunities to connect, to share, and to lead are constrained by cost, by distance, by poor policy choices, and by barriers that should not exist. This regional gathering brings knowledge closer, strengthens networks where they are most needed, and ensures that excellence is widely shared. Over these 3 days, you will explore excellence in education, in practice, and in regulation. They are interdependent. Stronger education builds more confident professionals. Better practice delivers better outcomes. And effective regulation ensures trust, quality, and accountability across the system. Together, they form the foundation of resilient, people-centered healthcare, and resilience has never been more important. Across our Commonwealth, health systems are under pressure from climate change, from economic strain, from weakening international development cooperation, from growing demand and inequality. But across every one of these challenges, I see the same truth. When we invest in nurses and midwives, we invest in solutions that are practical, solutions that reach communities, and solutions that endure. That is why the Commonwealth Secretariat will continue to support you, not only in recognizing your contribution, but in working to strengthen the systems, partnerships, and opportunities that enable you to thrive. Because partnership is at the heart of our Commonwealth. Partnership between countries, partnership between institutions, and partnership between professionals, learning from one another and lifting one another up. This spirit